How's it going? It's a really exciting time for health, especially in America now with Robert F. Kennedy being appointed head of the American Department of Health and Human Services. And what this means is a new era of transparency and freedom of speech, and also an open and unbiased scientific approach. And he's going to open investigations into a huge number of things. So what I'm going to do today is share the opening speech that RFK, Robert F. Kennedy, by the way, is the nephew of John F. Kennedy and the son of Robert Kennedy, who was also assassinated. So really interesting that he's involved. He's got a long history of, as a lawyer, of taking legal action against large companies that are polluting the environment and putting toxins into the food chain. And this is a big thing for him. So really interesting to watch this speech. What I've done is I've highlighted a few snippets and I'm going to talk to those briefly. So welcome along. Let's get into this.
And that has inspired a tectonic outpouring of enthusiasm and support from the American people. It's not difficult to understand why. In the U.S., 6 out of every 10 adults have at least one chronic disease, and 4 in 10 have 2 or more. The U.S. has the highest age-standardized cancer incident rate among 204 countries in the world, nearly double the next highest rate. Asthma and autoimmune diseases are far more common in the U.S. than in any other part of the world. Prior to COVID, American life expectancy averaged 7.8 years. That's about 4 years shorter than comparable countries. Autism now affects 1 in every 36 kids, a more than 4-fold increase over past decades. 18% of teens suffer from fatty liver disease. Nearly 38% are diabetic or pre-diabetic, and more than 40% are overweight or obese. These conditions were virtually unheard of when my uncle was president, 1960 to 1963, when I was a 10-year-old boy. The sperm counts and testosterone are down about 50% in American boys, and our girls are reaching puberty 6 years earlier than historical generations. Our only solution to these issues seems to be more and more pharmaceutical interventions that don't seem to be alleviating the problem, and in many cases appear to be worsening the condition.
Okay, so fascinating there that the health statistics in America are dire and they're in a real crisis. And when you think about the pharmaceutical industry, and over the last 150 years, it's really boomed, and people are taking much more pharmaceutical drugs than ever before in history. And yet these health crises are still escalating. So what does that tell you? They're not really addressing the cause of the problems, of these health problems, these chronic diseases, by the way, which you'll talk about a little bit more. But those chronic diseases have escalated dramatically over the last few decades, and so have the use of pharmaceutical drugs. So what are we doing wrong? He'll get into this a little bit further, but really interesting so far.
Science and democracy were born together during the Enlightenment, and they share the same ideals for openness, for public access, and for transparency. Science and democracy flourish from the free and unimpeded flow of information. No one trusts science that isn't transparent about its research hypothesis, its raw data, or its conflicts of interest. No one trusts a government built on lies, on secrets, on cover-ups, and propaganda. That's why my uncle famously observed that the word secrecy is repugnant to a free and open society. Our health is getting worse and worse. And when the total costs are over $4 trillion, as they are now, there is no good solution, only less bad ones. We need to start asking a very different question. regardless of who pays, why are we paying so much? Well, which is, by the way, 2 to 3 times what European nations pay for worse health outcomes. Well, corruption and efficiency may be part of it. But the main reason is quite simply that Americans are very, very sick. We are, in fact, the sickest nation on earth with the highest chronic disease burden in the world or in the history of the world. During COVID, we had in this country 16% of the global COVID deaths. We only have 4.2% of the world's population. So something we were doing was utterly wrong. And the CDC says that's because we're the sickest people in the world. They say that the average American who died from COVID had 3.8 chronic diseases. So were they dying from COVID or were they dying from chronic disease?
Another really interesting thing here is the chronic diseases with people with COVID. And that's not just with COVID, that's with almost every other cause of death. These chronic diseases are up to 90% of the causes behind the causes of death are chronic disease. So in other words, long-term insidious diseases that creep up on us. And this is a societal thing that we're suffering from, not just in the US, but all around the world. So he's really uncovering something interesting here. We're spending more and more and more money on our healthcare for less and less health. In fact, we're getting sicker and sicker and sicker as time goes on. So we're doing something absolutely wrong. And this, what we're going to find out later on, is something that we've been talking about for decades in the alternative or the natural health, traditional health care arena, which is toxicity. So it'd be really interesting to hear what he says about this.
According to some estimates, 90% of healthcare spending today goes toward managing chronic disease. When my uncle was president, it was 0. We didn't even have drugs for chronic disease then. And now it's become a burden that's threatening to sink our country. So my main mission at HHS, in which I hope that you will all join me, is to reverse the chronic disease epidemic in America. My goal as secretary here at HHS will be to create a culture of competency, of ethics, of openness, of transparency, of caring, of pride, so that individuals who share these ideals can flourish and thrive. We will remove conflicts of interest from the committees and research partners whenever possible, or balance them with other stakeholders. We will shut the revolving door to reestablish public trust. We will make our data and our policy process so transparent that people won't even have to file a FOIA request.
So what is a FOIA request? A FOIA request is a Freedom of Information request. So it's like we have the same in New Zealand, where you can request information from the government. And there's been a lot of that in recent times because people have suspected that the government haven't been giving us the full truth, or they haven't been transparent. And it's been made really clear when people have lodged Freedom of Information requests that the information the government had been giving us about a lot of things wasn't true. And in fact, sometimes you'll ask them for information and they haven't got any information. So it's a fascinating thing. If he can get that over the line, that will be a revolution for the health industry, where we can actually see what's going on.
Another reason why our agencies have lost public trust is that they become too politicized. Well, our health should not be a political issue. It should be an issue of science and an issue of basic human compassion. The science gets politicized when power and profit are involved, and power and profit are blind to compassion. Also,
Sorry, I better say something about that as well. When you look at scientific studies, a lot of the studies that are published have strong bias, and they might declare conflicts of interest, but you will often find that the studies are funded by the people that actually want the study results to be in their favour. And so it's been widely known for a long time that a lot of the journals, the scientific journals, have got huge bias, and there's a lot of money behind the scenes controlling the outcomes of a lot of these studies. So Unbiased science is what he's talking about here, which would also, it'd be a revolution in the scientific community if there was freedom of speech and people could actually publish the truth about what they're finding and be heard. So let's hope that happens as well. This is really incredible what RFK is proposing to do. Let's hope he can pull it off. I'll continue on.
Preconceptions. I'll start by acknowledging that throughout my career I've asked a lot of difficult questions and I've come to a lot of unpopular conclusions. I hope you will all join me in this commitment because the health of our people is a lot more important than being right or being vindicated.
Yeah.
We can start right now. Last Thursday, President Trump signed an executive order to establish the MAHA Commission to study what has caused the precipitous decline in American health over the past 2 generations. So we will convene representatives of all viewpoints to study the causes for the drastic rise in chronic disease. Some of the possible factors we will investigate were formerly taboo or insufficiently scrutinized. The childhood vaccine schedule, electromagnetic radiation, glyphosate, other pesticides, ultra-processed foods, artificial food additives, SSRI and other psychiatric drugs, PFAs, PFOAs, microplastics. Nothing is going to be off limits. Whatever belief or suspicion I have expressed in the past, I'm willing to subject them all to the scrutiny of unbiased science. That is going to be our template, unbiased science. That's something that will make us all proud of this agency and of our role in restoring American health.
Wow. Unbiased science, investigating toxicity. And this is something that just blows me away because we've been talking about it for decades, that it's toxins that are causing our chronic disease. And it's our chronic disease, which is 90% of the problem in our health system these days. And he's just saying there that they're going to investigate the vaccine schedule with children. Obviously, there's going to be a lot of pushback on this, a lot of pushback from the pharmaceutical company in particular, but some politicians are getting a lot of money from the pharmaceutical industry as well. So you can see what might go on there. Investigating electromagnetic radiation. So this is another thing that a lot of people have been asking for, but it's never really been properly investigated. And if it has, the truth is often suppressed, isn't it? So freedom of speech is a big, big thing when it comes to our health. It's not just in the political environment with opinions about political things, but it's a huge impact on our health. If we aren't able to talk or speak or, raise issues and have them looked at, then our health goes into this downward spiral based on money and profit in the pharmaceutical industry in particular. Processed foods, food additives, antidepressants, microplastics, the pharmaceutical drugs and the damage that they're doing, all of these things need to be investigated. And if this happens in America, you can see that that will spill over into other areas around the world. And you can already see it happening with the attitude towards freedom of speech and honesty and transparency. And these are the biggest things that we need to change, especially within our health system. So I'm really, really glad to see RFK in this position and what he's pushing forward. So let's just watch the last little bit I've got here from this talk.
Finally, I want to ask you to think about an even larger challenge to this agency. If we're really going to end the chronic disease epidemic, we need to recognize the connection between the physical decrepitude that now beleaguers our citizenry and the pervasive spiritual malaise that has left so many young people feeling alienated, dispossessed, disconnected, purposeless, and hopeless. Spiritual and physical maladies thrive on one another. They feed on one another. Our overall wellness must begin with a spiritual question. How do we relate to ourselves, to each other, to our communities, and to the planet? Vested interests in malignant political actors profit and flourish when we are atomized and fragmented, and uncertain when we can be easily propagandized. when we live in fear and helplessness and victimization. These forces prefer to have us in terror and anxiety, which disable our capacity for critical thinking and make us more compliant. And that has inspired a tectonic.
Wow, this is massive. He's also talking about holistic health here. So the body, the mind, the spirit. And it is an interesting fact that he's pointing out that when we're physically unwell, when we're toxic or we're addicted to substances which are spoon-fed to us through the industrialized food chain and the advertising and the propaganda that children are given from an early age, we become addicted into this cycle of hollow food and toxic food that's making us unwell and emotionally addicted to this food. Then we go down a spiral of becoming incapacitated mentally and spiritually. And so this is a fantastic thing he is talking about here. We really need to address the whole shooting box, not just get the toxins out of the food chain, but also introducing a far more transparent, truth-telling government. And it might be an ideal that's out of reach at the immediate moment, but in the foreseeable future, if we keep going down this path and towards more open and transparent and scientific research into health, who knows what could happen. So it's going to be a really exciting time over this next 2 or 3 years with RFK to see what comes forward and what this research reveals, what it's actually going to tell us. The truth may be emerging. So let's hope it does. Thanks for watching, and we'll talk to you again next time. Talk soon. Bye-bye.